The next speaker, may I invite the next speaker, Dr. Rainer from Austria. Rainer, you stay mute, please. Unmute.
Okay. Now you can hear me. Yes, I'm a GP in Austria and Vienna, and I studied a Masters of Tropical Medicine in Bangkok and worked in Africa and Asia. But I'm from Austria, and I just want to show a picture because many people from Asia know that it's Halle in Salzburg, because many Asians like to go there. It's very famous. And it shows that our country is very mountainous, and it lies in the middle of Europe, so close to Italy, between Germany, Italy, Switzerland, and Hungary, Slovakia, Slovenia. So it was quite close to the focus of the pandemic in Europe, which was Italy. And if you see there, it was Upper Italy, very close to the red, my country, Austria. So when the pandemic broke out in Italy, you know, it was all over the world. It was almost the hardest hit place in the world. The first case in Austria came to know from Italians from the 25th of February 2020 in Western Austria. And as you saw, a mountainous country has a lot of skiing resorts and people gathering close. So our focus, our first cases were there. And nowadays we are regarded to one of the best, recently from the Economist Intelligent Unit Research, reacting countries in the world. Given that the risk was very high to import the pandemic from Italy, we contained it quite well. How did we do that? First, I want to show you a number from Austrian students actually did that. They recorded all the figures in Austria, and it shows that we had only 668 dead people, which is like 10 times the number of Japan when you take in account that we are only 8 million people. We have about 76 deaths per million. But we contained the epidemic pretty well, and now we are down to 300, about 400 active cases. What I want to show in general is a picture that most of the people, like all over the world, are very old. This is the red bar on the right side. They're very old. But younger people are infected, but they usually don't die. We know nowadays that people are old or they're obese, overweight. And then I want to say a word to Europe in general, because I think this is overlooked all the time. We have very good statistics, and I'm interested in other statistics like that from America or Asia, if they're available. This is the excess mortality. It means the people dying in excess to the range of people dying. And if you look, I just want to show one graph. If you look at that graph, it's the excess mortality from 2017 to 2020. And if you look at the excess of the dying people, it's not so much different. We have a peak, but we had also a huge excess on 2017 and 2018. But nobody looked in it. So if you take the area under the curve, and there was a big catastrophe now in Europe, and now the excess mortality turns negative, we can say that not so many people died. And the containment measures were quite different in different countries in Europe. So we don't know really what worked, or if Austria was really so good. We just don't know, maybe we were just lucky. But it's obvious that we could contain it compared to Italy, which was our neighbor. That has probably to do in Austria also with the better healthcare system, where we don't concentrate people in hospitals, where we have better community-based healthcare system, because Italians rushed everyone to the hospital, even the old people, and they were foci of infection. What measures did the government take? It was very, very tough. It was all about social distancing. On 11th March, there were travel restrictions, social distancing, no public gatherings, schools and universities were closed. Actually, you were not allowed to leave the house. You were not allowed to leave the house. You were only allowed to go shopping, which was quite tough for 2.5 months for the whole nation. The holidays were ended, the skiing holidays were ended, all the tourism was closed down, which was very tough for our country. Shops were closed, public spaces were closed. So 2 months sleeping. Other infection control measures were taken in place when we opened up slowly in April. Then masks were introduced in public transports and supermarkets. And we had the rule that we should keep distance to people we are not living together. There should be a baby elephant between the people. That was the word. There should be an elephant between the people. So, and it is to say that 91% of the population agreed in March with the tough measures of the government, which probably had to do with the pictures from Italy, and which were a little bit like exaggerated, I think. And our chancellor, this is our most loved politician, our chancellor. He was very popular during that time. Now he's losing a bit. He said, everybody will know somebody who died. Actually, that was not the case. And there was never an indication that it will be like that. So many scientists, he had a group of scientists, the task force in his government, they didn't agree. And there was there is still a struggle with between politicians and the scientific community. And that is what is our main issue of discussion now, that scientists were not here. One even left the task force publicly, the only public health expert, because he said the measurements are not evidence-based. There is no need for locking the people in, which the former speaker maybe confirmed. In Japan, they didn't do that, and in many other countries, they didn't do that. But it put a lot of stress on the population. So there are public discussions up to now, and actually we don't know much. We don't know about where the measurements working. So now people say it was not good to scare the whole population by the politicians. Is it good to scare people to death to stay in the house? And many public health experts, and my experience concurs with that, say we don't know yet about the damage the measures did. Because when I was sitting in my office, almost no people came with like serious diseases. Like I had a man who had a lymphoma, a fast-growing lymphoma. You have heart attacks, which were overlooked. So, and I had mostly panic and stress disorders coming to my office. I have a lot of hypertensive crises and depressions, like double or triple the number. So people were really under stress. Of course, we had very few cases of COVID-19. The aim, the first aim was to protect the ICUs, because in Italy, they were overstretched, didn't know where to put the people. And this was achieved because we had less people on the ICUs during the whole pandemic than before. And this was achieved by the end of April. Every scientist, every researcher, every public health expert said, we will not be overwhelmed in this country on the hospitals because people can stay at home. And we have contained it in the nurseries, in the retired people's home. So people should go out, but the government was not letting the people out. So this certainly increased the burden of stress. But as we all know, correlation is not a causality, but the politicians will say we achieved, because of our tough measures, we achieved that no one died, or almost very few people died. While scientists said we have a data crisis. We need much more data to say which measures worked. So we don't know what would have happened if we did this or that. But politicians want to sell their success, of course. So that's the big struggle we are now in. And there is something I want to close, because this is really what's going on in our community now, big discussions. There is some word from a Nobel laureate called Daniel Kahneman. It's called WISEAITI, which means what you see is all there is. It's from the psychologist's research, which has to do with perception of things you put your attention to. And that happens in science, and that happened here too. Because I was born already in 1968. There was the Hong Kong flu, and there about 1 million people died. And in Europe, a lot of people died. But there was Woodstock, and there was big concerts, and people were gathering and socially interacting, and no one talked about it. No one talked about it. It was in the health statistics, but more people died. So I just want to put that on the table. And to close also, every year about 1 million children below age of 5 die from pneumococcal disease. And there is a lot of years of life lost. When we should protect the elderly, and we do that from many infectious diseases, so we shouldn't concentrate them, we should protect them. But the life lost in the COVID situation in Italy was very, very short, but many people died. So it's a different statistic. It's a very different situation for old people and for younger people. For younger people, this is almost not very dangerous, SARS-CoV-2, but for older people it is. So we have to protect them, but we also have to think of other people. So it's a question, where do we put our attention? So that's how I want to end, because I think we have a very, very ethical discussion here coming up, how we are dealing with diseases. Is every measure justified? I like my speaker before, the professor from Japan, because they took other measures. We don't know, Austria was much under danger, but we don't know what really worked and what we do through our measures, and if we overlook other people in the world. So that's what I wanted to say. We don't know much about Austria. Thank you very much.
Thank you very much, Rainer. It's a very interesting presentation.